It is time to have the best birthday ever at Cass Health. You and your provider have decided that you're having an induction, which means that your doctor and OB nursing team are there to help jumpstart your labor and delivery. Having an induction can be due to medical reasons, or you and your doctor have just decided it is time. Inductions are scheduled between you, your provider, and the OB department. Your provider's office will give you a day and time to arrive at Cass Health. You'll check in at registration and then head to the OB department on the second floor. On your arrival, our OB nursing team will work with you to complete any necessary paperwork and inputting your information into our computer system. Once you're gowned and comfortable, the OB nurse will start your IV. Either your doctor or your nurse will most likely do a cervical check to determine what your dilation and effacement is. These two measurements, along with your baby's position, are 3 ways to evaluate how your labor is going. Dilation is the measurement we use to describe how open the cervix is. It is typically measured in centimeters from 0 to 10. 0 centimeters, your cervix is closed. 10 centimeters, you're fully dilated and ready for birth. Effacement is a measurement we use to describe how thin or shortened the cervix has become. It is measured in percentage from 0% to 100%. 0% equals no thinning, cervix is long and thick. 100%, you're fully thinned out or you're effaced. Position is a measurement we use to describe how far the baby has descended into the pelvis. It is measured in stations. 0 station, the baby's head is at the level of the ischial spine, or the middle of the pelvis. Negative numbers, your baby is higher in the pelvis. Positive numbers, the baby is lower, moving toward delivery. Your doctor will decide how to start your induction based on those measurements. There are a few ways to get labor going, and sometimes we do more than one at a time. The most common induction methods we offer are cytotec, Foley bulb, Pitocin, and artificial rupture of membranes. Cytotec is a medication used to ripen or soften and thin the cervix. It can be given orally or vaginally. A Foley bulb is a mechanical method of cervical ripening. A small balloon is inserted into the cervix and inflated with saline to help gently open or dilate the cervix. This mimics natural pressure from the baby's head. Pitocin is a synthetic form of oxytocin, the hormone that causes uterine contractions. It's administered through an IV to induce or strengthen labor contractions. Artificial rupture of membranes is a procedure in which a healthcare provider manually breaks the amniotic sac or your water to stimulate or speed up labor. This is done using a sterile tool during a vaginal exam. It's good to know that sometimes an induction can take longer than a spontaneous labor. We remind patients not to lose hope and to remember that the first part of induction is simply our way of talking to your body into doing something it may not have been quite ready to do yet. Try to rest when you can, and you feel up to it, get up and move around. Once the induction is underway, you are now considered to be in labor. Next up, please watch the labor video for more information on labor stages and pain control. Congratulations in advance. No matter if you go into labor on your own or your body needs a little help, you are doing amazing.